Hi, I'm Eugene Yamamoto. I'm a physician and assistant at our office. We treat largely nasal and sinus issues. Now, a common question that we get is, what defines chronic sinusitis as opposed to just having a common cold or acute sinusitis? The common cold tends to last maybe 2 to 3 days, up to a week or so. Comes with the traditional symptoms of nasal congestion, drainage, sore throat, or cough. But as most patients would tend to experience, common cold will come and go fairly quick and easy. It's fairly contagious as well. Now, with acute sinusitis, it will come with symptoms associated with sinus pressure, significant drainage, and acute sinusitis does tend to last 1 to 2 weeks. Large signs of the acute sinusitis being more of a bacterial infection rather than a viral infection is if the infection tends to linger for beyond that 1 to 2 week mark, or seems to get better and then all of a sudden gets worse, which we call double worsening, where a bacterial infection secondarily potentially has settled in. At that point, most patients will require antibiotics. When we tend to identify a patient who has a chronic sinusitis is when the acute sinusitis type of symptoms persist for beyond that 2 week mark or beyond a single course of antibiotics. Some patients can suffer for months at a time or just feel like they always have a sinus infection year-round long. As I mentioned before, a lot of these symptoms have to do with sinus pressure, really thick white drainage, or poor smells or bad smells of the nose or mouth.